Good morning. I am Rebecca Silvestri, VP of Sales and Marketing with Local Profile Magazine. Today, we are doing Local Leaders, an interview series with local leaders. We're chatting about different exciting and interesting topics. Today, we're talking with Dr. Jessica Shellock. She is a board certified orthopedic spine surgeon with the Center for Disc oh my God, with the Center for Disc Replacement at Texas Health Diagnostics and Surgery in Plano, and she's also part of the Texas Back Institute. Welcome, Dr. Sherlock.
Hi, thanks for having me. I appreciate it.
Awesome. We are so excited to talk to you today. All right. Okay. So first of all, tell me a little bit about what it means to be a orthopedic spine surgeon. Like, who are the patients that you're dealing with, and what kind of issues are you seeing?
So, with spine surgery, there's generally two tracks to become a spine surgeon. There's the orthopedic track and the neurosurgery track. So with the orthopedic track, which is what I did an orthopedic residency. It's a 5-year residency. During that residency, we spend time doing spine surgery. I then completed that residency and then did an additional year of a fellowship training, which was just spine surgery, complete spine surgery for a year. And I did that at the Texas Back Institute. And then I began my practice in 2009. The patients that I see are patients that have been suffering with neck or back pain, arm pain, leg pain. They're coming in oftentimes after having failed conservative care with physical therapy or chiropractic, or maybe their primary doctor sends them in, and then I evaluate them to see, is there a role for surgery, what are the options, that kind of thing. Everyone has a unique sort of niche, I think, with their practice in surgery, and so for me, a large part of my practice is really focused on kind of degenerative disease of the neck and the low back. I'm not a deformity surgeon. I don't do big scoliosis surgeries. I don't do tumor surgeries, that kind of thing. I kind of think of it as I do a lot of the run-of-the-mill, the bread and butter, the stuff that, affects people routinely.
That makes a lot of sense. So tell me about maybe your average patient. Like, obviously we can't talk about anyone specific, but maybe something that the most common thing that you see, or maybe something that's the most common thing that you see that people have been suffering with for a long time and maybe could have fixed a lot sooner.
Yeah, I mean, that's a good point, especially I think in light of recent situation going on in the world where people are very leery to come out maybe and be seen in a hospital setting by medical professionals. One of the most common conditions is a herniated disc, right? So, people have heard sciatica, which is basically referring to leg pain from nerve compression within the spinal canal. And I think that's something where, people put up with it for a while if they can. Sometimes they'll think, oh, maybe it's a pulled hamstring, or maybe it's just going to go away. And when it doesn't, or if it gets worse, or people start having weakness and, really affects their day-to-day life, then usually they'll come limping in to see me, and, we'll get an MRI if they already have one. And if it's something where, they truly have failed all the non-operative options, then, that's something where a small surgery can be done to remove that herniated disc fragment and give people relief. That's probably one of the more gratifying surgical procedures and one of the most common spine procedures. So hopefully that answers that part of the question. I think, to the people out there right now who are also scared of just, being seen, everyone's taking a lot of precautions to make it safe for patients. And, if you really are suffering, definitely we're doing telemedicine too. There's options out there. So let's, hopefully that'll give patients some sense of security with their issues.
Absolutely. And I'm sure some people think, well, if I have an issue and I really have something that's to do with my spine, I need to see you. Okay, so can you walk me through and maybe show me some of your protective gear? Because I know you're hiding it and I want to show everyone.
I know, right? I showed you earlier as kind of a semi-joke, but sure, I'm going to reach around here and I'm going to show you because I didn't want to scare people away. But I think that on the flip side, maybe it makes people feel comforted, right? So anytime someone comes in to be seen in our clinic, first off, we're making you fill out a little checklist questionnaire to check your exposure risk. We're screening your temperature. We're making you wear a mask. Actually, we're giving you one of ours and gloves. And then when you see me, you might not recognize me in the clinic because I will be having this on my face. and I sound
Wow.
like Darth Vader. And then in addition, I'll have my face shield on over that. So, and I wear gloves. I change them out between patients. I'm surprised that we have fingerprints left with all the hand sanitizer we've all been using. But and we're limiting the traffic in and out. So our templates have definitely dropped as far as the total number of patients. So we're doing everything to make it safe.
Okay, so on that vein, and being a spine surgeon, like what, in your opinion, are some things that is safe for us to go out and do, and some things that you're like, you know what, I don't think that's a good idea, don't do that?
And we're talking in relation to COVID, correct?
Yes, obviously, yes,
Yeah.
that's right.
Well, yeah. So, because I was going to say no trampolines, but that's not COVID related. But no. So, I think that, for me personally, and everyone has their different opinion, I just don't think that it's reasonable to go into an indoor restaurant or any place where you're in close proximity to others. As a family, we still have not gone to even an outdoor restaurant to sit outside, because some of the places where we live that we've gotten takeout from, when my husband's gone to get the food, he's come back and been like, it was packed and people are outside and they're all next to each other and not many people are having masks, which you can't wear a mask to eat, let's be honest. But so I'm still a fan of takeout personally for food stuff. I think it's safe to go to like a store, with wearing protective gear. Wear a mask if you have to go to the grocery store, or if you have to go to Target or someplace. Obviously, most of these places, it's been great to order online and have it delivered, or go and get it picked up there. But sometimes you just kind of need to like go get something that you need to hunt down, and that's fine. I think that just steer clear of people. Wear your protective gear. Don't put your hands near your face, and I think you're okay. One of the things that has come up with my family, and even in just talking to friends and patients, is it safe to go get my hair done? Which sounds like a totally girly thing to bring up, but people want to know, right? And I think that it is, as long as you make sure that wherever you're going, that they're limiting traffic, that everyone's wearing a mask, and that you can try to be as safe as possible. So for me, when I went, and I was a little freaked out by it, but I wore an N95 mask, and then but with the ones that go behind the ear, and I just let it stay there. I didn't care if they got color all over it. It doesn't matter. That's my hair mask now, and I felt like it was okay, and I didn't have them blow dry my hair. They weren't anyways. I just was like, I'll take it wet. I'm going to go home, but I think that you can do a lot of social things to make you feel human again.
That's awesome. I'm relieved to hear that, because I have not done my hair, and I think it's obvious. I'm coming to the hairdresser now. Thank you. Saved me for the week. And for the
You're
last
welcome. I'm glad. Perfect timing.
Okay, so you are one of the only female spine surgeons in the DFW area. So what makes what you do and your practice unique?
Well, obviously being the only female spine surgeon in our group, with 19 male surgeon colleagues, I stand out in all the pictures of the group. It's definitely for patients who sometimes patients want to see a female, and so that makes it very easy for me. But I think that my practice philosophy, which may not be unique overall in the spine world, but I look at it as trying to make it a personal experience for my patients. For one, I don't have a PA or a nurse practitioner. It's me. I see all my patients. I make all the treatment decisions with them. And I think that's a little bit unique in today's world, where a lot of times you won't see the surgeon until it's time to discuss the surgery, and other people have kind of seen you along the way. I like to get to know my patients. I think that helps in knowing whether or not they're a good surgical candidate, or what type of surgery would be best for them, because there's no one size fits all in what we do in spine. There are so many options generally for different conditions. And, I look at it as oftentimes less is best, right? You can always do more, but you can't undo. And so I try to take the approach that, hey, what's the least I can do to address somebody's issue without setting them up for needing something worse down the road, or for having, potential complications from something that's bigger than maybe they needed. So I think, that's a little bit of a unique perspective and has worked well with the type of stuff that I do in my practice.
So I believe you're the youngest and one of the newest at the Center for Disc Replacement. Why did you choose to move to the Center for Disc Replacement?
Well, it's kind of just like an extension of my practice, I guess. I'm not necessarily like moved to it entirely, because I still have kind of my own non-disc replacement practice. But it's something that I've been a believer in for my entire practice. I think that motion preservation has so many advantages over spinal fusion, and I wanted to be part of a center where we're really trying to create a center of excellence for something that's a very specialized procedure. So, that was sort of a natural draw for me. And, over time, I expressed interest to my senior colleagues that have, been part of it, and was brought in earlier this year as kind of the junior co-director member. But I hope to make that a greater part of my practice moving forward over the next 5 to 10 years.
That makes a lot of sense. Okay, so how do you balance being a mom and a spine surgeon, and what kind of lessons do you feel like you're giving to your children?
That's a great question, and it's a complete balancing act. I feel like I'm a constant juggler. I wish that I could order a superhero cape on Amazon Prime and just get it all done. But unfortunately, they've been on back order for years, so I can't get one. And so I just have to kind of, try to prioritize things and try to get it all done. For me, I think that with what I do for work, it's not a 9 to 5 job, right? I don't check in at 9 and then check out the clock at 5 and I'm home and I'm done. It's just a different type of scenario where there's always something running in the background. There's processes running. There's always patients that are out there who you're thinking about or worrying about, waiting on studies to get done, or someone who just had surgery and you're hoping that everything's going to go well and that the recovery is going to be smooth. You're on call. We teach fellows. We've got educational things going on throughout the week. So there's really there's not really a down moment, right? And that's hard when you have family and kids, because they, they see me and I'll come home and, one of the things that I think is kind of funny is I'll jump on the Peloton, right? That's my exercise these days. But I'm sitting there on the Peloton and I'm looking at my phone and I'm returning work texts or emails. And my kids are like, Mom, put your phone down. And I'm like, I can't right now because I'm trying to multitask, right? I need to exercise and I need to get these done. So if I can get it all done together, then I have time with you guys in 30 minutes, So it's crazy. I mean, I definitely, I think that right now with they're young, my son's 9, my daughter's 4. So they don't quite get it. But I think they do realize that my work is demanding, and they know that I help people and that that's a good thing. But I don't think that they're quite old enough yet to understand just how far reaching the implications are when you're in medicine. It really is something that encompasses your time all the time. I mean, yes, you can let it kind of be quieted down for a little bit, but it's always there. It's always there.
So what other advice might you have for females in a demanding role and trying to balance whatever it may be with looking after kids and family life?
I think it's just a matter of, making sure that you prioritize when you have to, right? So for me, during the work week, Monday through Friday, it's probably more of a split that's more work time than family time, because I leave and most of the times everyone's still asleep, and then I get home and it's dinner time, right? But so on the weekends, then I try to flip those numbers, and of course now we're all hanging out at the house, but prior to all this, we'd go do stuff and spend time together and just make those memories. And, I think the other big thing too, again, in pre-COVID life was that whenever there was something really important related to like the kids or school, you got to be there, right? Like nothing is more important than your family unless there's some awful emergency that you're dealing with. But make the time for that. So, if it was like the Valentine's lunch at my son's school, I would book out of my clinic or whatever, and I would be there, because that's what lets your family know that despite all the distractions, that they're still your priority too, and I think that you can do it all. You just can't do it all at once.
I love that. Okay, you can do it all, just not all at once. Brilliant advice. Well, thank you, Dr. Sherlock. I've really enjoyed talking with you this morning.
Thank you. Me too. This was great. And now I'm so excited that you're going to go get your hair done and be happy that we did this.
Well, thank you. And thank you for everyone at home watching. Please join us next week, Tuesday at 11:30. I'm going to be chatting with Stephanie Jeffrey. She heads up diversity and inclusion with Capital One Financial Services. Bye-bye.
Bye. Thank you.